Today here we are gonna discuss about family skills prevention program. So we have speakers from different countries in the region that are gonna share their experience implementing different family based prevention programs, primary substance use prevention programs in the region. So thank you again for joining us. And for the interest of time, we're going to start our presentation. And the first speaker will be my colleague, Ms. Luki Pramitasari. She is a certified clinical psychologist with experience working on drug-related issues. And for the past 4 years, she's been working with the UNODC, United Nations Office on Drugs and Crime, and starting with the drug prevention team and currently working across both drug prevention and criminal justice programs. So Luki will be presenting about the implementation of the Family United program in Indonesia. Luki, the floor is yours.
Okay, thank you, Zinko. I will try this. Okay, good afternoon, everybody. Yes, I'm gonna start about the Family United in Indonesia. Where should I point it out? Sorry, maybe I have to. Oh, is it working? What happened?
Sorry. Just only these like this.
I only Yeah, while waiting, I'm gonna go downstairs.
Please bear with us for the
so
technical
I can see the
glitches.
person. Okay,
Yes.
thank you very much. So, my name is Luki, and I'm gonna represent about Family United Program Indonesia. This is one of the family skill program that UNODC have, and we started from 2019. We collaborated with our government, our agency, National Narcotic Board Agency, and we start all the training for facilitator along with Bangladesh at that time. So we have two separate first pilot project for the Family United. And at that time, we also collaborated with the university in Indonesia to have the research going on. And after 2019, we have the pilot project succeed, and it showed that this program is suited for Indonesia. And from then, BNN adapted the program into their national program, and they call it like family resilience. It started on 2020, but at that time, the COVID is coming, so the training is like a little bit on hold, on offline. So we do it like online to like 207 offices in Indonesia, and at that time, the module of the Family United program itself is not finished yet. It's like the version 1. And that's why on 2023, we started to do the second phase of pilot project for the newest module of the finalized Family United module from UNODC at that time, because we want to see the consistency after the new version of the Family United module. And we do the second trial in 2024. And this is the first pilot project that we have and is already on the international journal. You can see it in here. And based on that, the background for our second pilot project, we do it in 2024. And this is the Family United itself. The Family United is a family program, but not like other family program that only come with the caregiver or the parents. Family United is a program for the caregiver and also the children, which we separated into caregiver session, child session that go parallel in 1 hour session, and then have a break, and then they gonna do a family session together. So it's gonna be like 2 sessions for 2 hours, 3 sessions for 2 hours. It's a caregiver session, child session, and the family is a caregiver and children together. What we aim for this program is about decreasing risk factor and increase protective factor. This is the short-term participant and family impact that we aim. Is about improving the parenting skill for the caregiver and reducing the behavior, the negative behavior for the children, and also we want to see improve mental health for caregivers and children. This is the model of Family United, and this is the one that we adapt together with the National Narcotic Boards. This Family United model is a universal prevention. So it's more like prevention for everybody, but the family that not yet have or have problem with drug use. So the children have to be age from 8 to 14 years old, but sometimes in Indonesia we can go until 15 years old. And initially, we do it like this, like I said before. The parents and children will attend separate group session, and then they will reconvene as a family for joint session. There are gonna be like 4-week session. We're gonna do it each week, so it's gonna be a month of program. This is the result that we do for the second pilot project. Sometimes, because it's like a 4 weeks programs, in our control group we lost like 9 families because they not come like every week. So we just can like compare it between 91 family and 100 family from the intervention group. And this is the tools that we use for the measurement. Is strengths and difficulty questionnaires, and also we use parenting and family adjustment scale and child and youth resilience measure. And of course, this is like the quality or satisfaction for the facilitator. I'm sorry, still Indonesia. And this is the result. So we can see, even though we use the new model, this result is quite the same. The difficulties behavior from parents and children is decreasing consistently. We can see the blue one is the experimental group and the orange one is the control group. So it's like declining in the experimental group. And also in parenting and family adjustment scale, we can see the experimental group is increasing, improving. Like we do it like time 1 is the previous one, the pre-test before the program is conducted. The time 2 is a week, 2 weeks after the program conducted. And time 3 is like a month after the program is conducted. So we can see is improving in is consistently improving. And for the resilience measurement for children is also, we can see it's improving. So even though it's like we do it the program like a month ago, it shows that the children still have the skill to make them resilient even after a month after the program. And the satisfaction, with intervention score, because this program mostly do it like a lot of role play and not just like lecturing or seminar. That's why the satisfaction and the satisfaction rate is high. It's like from 0 to 5 score. So this is the score for the implementation, and this is for the facilitator. So it's a very fun program because we gonna do it like many role plays, many games for children. That's why the family keep coming back, even though it's gonna be like a week, a 4 week, and they gonna come in every week. This is the lesson learned. If you're gonna, this is how we do it in Indonesia. First, we contact our government. Of course, we have to do the collaborative approach. We do it with our government, the National Narcotic Board there, and also the university, because they have like community programs, so they can be our second hand to do it in the ground. And for the research, we get the help from the university too. And the adaptation module, of course, sometimes we gonna be questioned, is it like suit or not in our culture? Because sometimes we have to adapt it, or maybe some role play we have to adjust it with our culture, so it's gonna be like cultural appropriate. And facilitator training. This program mostly facilitator have the primary role in here, because the facilitator gonna have a good relationship with all the participants. So if they cannot have a good facilitating skill, the family don't want to go back in every week, and we're gonna lose participants. And also, this is the lesson learned. We do the pilot and revision process. We do it like 2 times. First one we do it in West Java for like 6 cities. And then after that, we do the revision first, so it's gonna be culture appropriate. And then we do another task for like 10 cities for knowing that the module that we have revision is still feasible or not. The challenges, of course, is gonna be the budget, because Indonesia is quite a big country and have a lot of cities, a lot of citizens. We have like 270 million people in Indonesia, so we need a lot of collaboration, a lot of facilitators. And nowadays we only have about like 800 facilitators that spread all over 207 cities, but not all of them have an offline training from us due to the budget and political changes in our government right now. And of course, consistency in module version is important. We need to to know the program is working or not. I know sometimes, like in Indonesia, we have so many language all over Indonesia, different cities, different province, different districts sometimes have a different kind of language. Yes, they can change it into their language, but we need to do some consistency too. So the program structure is still the same, the content is still the same, but you can change it into your own language. And the capacity of facilitator is also important. That's the challenges, because sometimes because this is like a skill base, so we cannot do it like only online, because we tried online, and then when we do the offline training and like scoring their capacity, they have very different skill from along like at our 800 facilitator in Indonesia. And this is how we scale up in Indonesia, because we work with the government. We develop pool of training of trainers. So we do the TOT. So in every province, in every island that we have in Indonesia, we have a pool of trainer that can do a training for facilitator there. And we integrate this program into national policy. Now we have this program as our national program. It's called Family Resilience. And leveraging technology, because sometimes it's hard to do the offline training, we make an e-learning. It's about a basic of prevention, a basic skill about this program. And we also sometimes do the online supervision for all facilitators that conducted this program. And of course, expert partnerships. Now we're not just working with the national narcotic boards, but we also work with NGO, and also we have like this NGO that call like family welfare program. It's like a community that the leader is the wife of our mayor, of our leader in the district. So they can do the grassroots and conduct it in their area. So the program is getting bigger. And that's all from me. Thank you very much.
Thank you very much, Luki. I'm sorry I didn't introduce myself. My name is Singkoko Lin. I work for the UNODC Regional Office for Southeast Asia and the Pacific based in Bangkok. And I'm very honored to be your moderator of this session today. And to give you a little bit of background, we at UNODC, we developed jointly with WHO, we developed an international standards, a document called International Standards on Substance Use Prevention, which analyzed all the available resources for their efficacy, effectiveness in terms of preventing substance use among young people at different ages. And family skills prevention programs are among the programs or interventions that are proven to be effective prevention strategy. So, it's really encouraging to learn from the Indonesian experience of implementing the Family United program, which is one of the family skills program that UNODC has developed after the launch of the international standards for substance use prevention. And Indonesia is one of the countries that piloted Family United in the region. And thank you so much, Luki, for being an advocate for promoting family-based prevention programs in Indonesia. And yeah, thank you very much. I hope we will have some time for questions and discussions, comments after all the speakers have presented. So if you have any questions, please note them down and we will definitely give you some time to raise your questions. I'd like to move to next presentation, another country presentation. So I have my colleague, Ms. Shella Ruiz-Marquez, joining with me today. She is the Program Officer of the United Nations Office on Drugs and Crime in the Philippines. And she is the Program Officer of the Health and Drugs Program in the Philippines. And she is also in charge of scaling up family skills program in the Philippine setting as well. And with Shella, I am very glad to have our friend and colleague, Mr. Dori M. Coronado. He is the ADAC focal person of the local government unit, Antipolo, overall in charge with the implementation of the UNODC Dangerous Drug Board, DILG, and City of Antipolo policies, programs, projects, and activities pertaining to the overall drug abuse management strategies. So we are very glad to have you two here today to present the experience from the Philippines. The floor is yours.
Thank you, Zinko. Very pleasant good afternoon to everyone. It's an honor and a pleasure for the Philippines to share with you our experience in supporting and implementing prevention programming and intervention, specifically the family skills-based programming. But before I dive into presenting to you how we are supporting the Strong Families Program in the Philippines, let me first give you a context about the Philippines so that you would understand our journey, how we successfully implemented prevention programs in the country. So I think it's not hidden to the whole world, right? That at one point in our history, the recent past, you know, the Philippines has gone through the war on drugs, and there's been a lot of human rights violation practices. There were a lot of barriers in order for us to actually implement evidence-based either prevention, treatment, or aftercare. It was difficult at that time, or even harm reduction services. And Zinco, earlier you were reporting about the gaps, or the huge gap in terms of accessing services. And Philippines is not an isolated case to other countries. So we've been through a lot of struggles and challenges in order for us to actually be able to offer an evidence-based program to the community. However, although we have a very punitive law, and up until today, it is still punitive, although we are currently going through a policy reform, which we hope that it will push through in the coming years or in the coming days. Okay, but at the end of the tunnel, there's still, a light. The Philippines has a very good family code. The law supports promoting and protecting the rights of every family. So that's an angle where we take the opportunity to actually introduce programs such as the Strong Families or Family United program in the country through our service providers, like our partner here in one of the cities in the Philippines. So they are really our champions, the service care providers in the community. Yeah. So in 2019, that was still a time where, there's still an ongoing war on drugs at the time. We managed to introduce the Strong Families program in the Philippines because, as part of Asian countries, we give so much importance to families. So somehow, that's a good window of opportunity for us to engage with the community. It's an open or welcome idea to some of our government officials to support programs that surrounds or around topics around families, that talks about building family resilience, strengthening communication and bonding within the family. So it's a topic that's quite neutral and well received in the country. So the developer of the program herself came to the country, and then we gathered, I think 30 people to be trained as facilitator of the Strong Families program. In my next slides, in the following slides, I'm trying to show you pictures of people that we've trained so that you see the faces of people who have supported us in implementing the program in the country. So you see, as was mentioned by Luki earlier, the sessions are more interactive. You create connection during the session. So it's not a boring session, it's a fun session. Okay, so these are the training of facilitators. So in the training of facilitators, of course, we build on their knowledge, not only the skills, but their knowledge. We try to remove the misconception of people, and we highlight on the importance of healthy parenting. In this program, we don't even mention about drugs. We highlight on how we build on the pro-social skills of young people, as well as increasing the parental skills. Because we believe if we arm our parents with proper skills, on how to engage properly and efficiently with their children, that's already a meaningful prevention strategy. Because remember, there's no school for parenting, right? Especially for young parents, it's hit and miss. So meaning to say, families need support. Family needs help also. Yeah. And we also highlight that when we work on prevention, we are not only preventing drug use, but also other risky behaviors like violence, abstinence, and engaging in risky sexual behavior. So we really, we really give emphasis in the community to invest on prevention, intervention, and programming. Yeah. So like I said, we highlight more on strengthening family relationship, and also these are the messages that we are highlighting. So unlike Family United, Strong Families is also only implemented in 3 weeks. So you only need 3 weeks from the family, 1 hour, ideally 1 hour per session, 1 time a week. But sometimes when you are in the heat of the discussion, when families are very engaged, sometimes it extends up to 2 hours or 3 hours. But of course, we remind our facilitators that you have to be mindful to respect the time of the family because they need to work. Sometimes they need to take care of their children. Sometimes they need to cook for their children. So those kind of things we are taking into consideration as well. Yeah. So I just want to show you and highlight also that the UNODC Family Skills-Based Programming can be implemented in a low-resource, setup. So you don't have to spend a lot of money. So as you can see in the Philippines, they use the open area to actually engage families, sit down, and do the activities as prescribed in the manual. So you just have to be creative, or the facilitators just have to be creative, and you can use materials from the surrounding. They use sticks, they use stones, they use the cheapest paper that they can find. Yeah. So you see the kids are very much engaged as well as their parents, and there are also times when some families, they have babies, with them. And that's okay. We also support them. Sometimes we include a team who can provide daycare for the babies. So this is another setting. So in this setting, we also implemented the Strong Families program in the school-based program. We have this framework in the Philippines we call Parent and Teacher Association. So we tapped this association, we partnered with them so that we can implement Strong Families program in the school setting. This is another setting. This setting is in a barangay. Barangay is a small unit of government in the Philippines. So it's like a small community. So they have a chieftain. What we do, we partner with the chieftain, and they mobilize their people, and they mobilize, families so that they can benefit also in the program. So you see, my point is the Strong Families program can be implemented in various settings, in different settings. And here I just want to show you how comfortable the children are. See, they feel safe. We provide safe space for families to talk, to discuss, and parents really appreciate this kind of approach. Okay, so after we conducted the training of facilitators and also pilot tested the program in the country, now there was a time when we asked ourselves, we want to know if the program is really feasible in our community, in our context. So we conducted a randomized control trial. But let me warn you, it was an ambitious plan also, because we targeted at least 10 communities in the country. It's a multi-site randomized control trial. Would you imagine, how expensive it was and how difficult it was? So we engaged 211 families in the RCT. But of course, research sometimes can be, how do I say, can be tricky, right? Especially in handling the data and the information that you gather. So out of the 211, all clean data that we have went down to 67 families. 67 families. 69. Okay, we have the wait list and the intervention group. So families came from diverse background as well. There were parents who came from a family that's divorced, who came from a family who's cohabiting only, or who came from a family that's being led by grandparents. So they come from diverse background. Okay, and the socioeconomic background are also very diverse. Okay, so as you can see, let me look at my notes so that I can be accurate. Okay, so this is the total strength and difficulty questionnaire score ranges from between 0 to 40. 0 to 13 are within normal range. 14 to 16 are moderate ranges, and 17 to 19 are high, and 20 to 40 are very high. So in this data, you can see that the scores baseline were normal ranges, and there is very little room to improve. Though notably, there's a slight improvement in the intervention group. So interestingly, it is likely that there has been a contamination of information or intervention. So meaning to say, the intervention group shared some information, the controlled group, no, the intervention group shared information to the controlled group. So somehow, that's why you can see in this data that there's also a slight, improvement among the controlled groups. Yeah, so that can also be viewed as a positive, on a positive note, because that means families are sharing their experiences, are excited about what they experience in the session or in the program. Yeah. Okay, so maybe I will not explain it one by one. It will take me so much time, but the point is, in a lot of areas in our study, there's significant improvement in both intervention and the controlled group. There can be a lot of reasons. One is the contamination of information. The other one is that there's high likelihood that they receive other interventions also coming from the government. Because at the time when we did the study, I remember it was an election period. So meaning to say, government are really doing a lot of effort, to provide programs, services, and intervention to families. And then another angle could be, maybe the community, some Filipinos are very conservative in reporting their experience, or really shy to share, the reality of what's happening in their family. That's also possible. Yeah. Yeah. But yes, just to highlight, we've seen improvement. Okay, so as a last note, we must remember that when families are meaningfully engaged, not merely informed, but empowered and actively involved, prevention becomes more than a program. It becomes a shared journey anchored in trust, connection, and resilience. Families are not just stakeholders, they are our most vital allies in safeguarding our communities and ensuring a safe, secure future for our children. And lastly, just to highlight, our recommendation is to have another round of, a more deeper look into how really the program impacts the families in the Philippines. Yeah. So I will now hand over the floor to my colleague because the city that he's leading is the newest city who now start to subscribe to the Strong Families program in the Philippines.
Thank you very much, Shella. Good afternoon to each and every one of us. Antipolo, as part of the Rizal province, has a million population. And Antipolo, as a local government unit, has 16 barangays. So what Shella mentioned, barangay is the smallest unit of local government unit in the Philippines, wherein it is headed by a barangay captain. Now, since our inception, the city as a whole, our inception from the UNODC's program started last 2023 when the UNODC piloted a program entitled Antipolo Declaration. This program by the UNODC focuses more on the human rights-based approach and harm reduction framework. Also, in the early part of 2025, first quarter, Shella, together with Daniela Marquez of the UNODC Manila, introduced to us the Strong Families program. So all the participants who were capacitated and trained are the barangay health workers, those who are working and living in the communities, as well as the youth leaders, and we also included those who are in the policy making in the barangay level. For us, and as the ADAC focal person, Anti-Drug Abuse Council focal person in Antipolo, we found that the Strong Families program is very important. This is very inclusive for us, and this is very vital for our clients. Our clients in the Philippines, we call them P-Woods, the persons who use drugs. Because it will help them address the stigmatization and dilemma that they are facing, and it helps them proactively in their recovery or journey while they are still in the program. Why this is important? Because respecting one's rights and including them as part of the process enable us to understand where they are coming from. Engaging with them helps them significantly in their journey or in their journey on their recovery by providing them a tailored fit services. Challenges mostly are on the shoulders of those who are in the facility, those who are handling the facility, the treatment and rehab facility. Why? Because when they are about to release the clients from the treatment and rehab facility, again, the time that they are about to being exposed again to the community, poses some risk again if those part of the community are not fully engaged with the program. Let me share some data of Antipolo last 2024. We have 104 clients who walk in to our office asking for the programs, the free rehabilitation program of our mayor. Out of the 104, there were 47 ages 15 to 19 years old. After the assessment done by a psychiatric or psychometrician, 47 of them, they were referred to a psychiatric facility. So that saddens us because normally it is not usual for these youths to be engaged early on illegal drugs. And then 10 out of the 104 are benefited the free rehabilitation program of our mayor. Our office, ACADAW, Antipolo City Anti-Drug Abuse Office, also conducts information education campaign by capacitating, training all the barangays, different organizations such as tricycle operators, homeowners association, and other sectoral groups. We are discussing also to the different schools, the different protocols that the school and the school management needs to know about how to deal with students who are involved in selling or use of illegal drugs. They are still being monitored, and we are also looking forward for more collaboration and engagement with our partners such as the UNODC, the Dangerous Drugs Board, and other advocates to gain more experiences and to be able to adopt the different best practices from this organization. Thank you.
Thank you very much. Thank you very much, Shella, and thank you very much, Mr. Dodi, for sharing your experience from the Philippines. Thank you for rolling out the program in your jurisdiction as well. And it's very encouraging to see that this is happening. So in Indonesia and in the Philippines, UNODC and the government counterparts have been working closely in rolling out the evidence-based family skills prevention program. Now I would like to move to another setting where UNODC and our civil society partners are working together to promote evidence-based prevention. I have my colleague, Dr. Chun Brang. He is the UNODC program coordinator in Myanmar. And he's a medical doctor by background and has more than 10 years of experience in public health. And he's been working very hard in promoting the evidence-based intervention in terms of prevention and treatment in Myanmar. And we are happy and very glad to have Miss Kaineri. She's the director and founder of one of our partner civil society organization in Myanmar with background in engineering, chemistry, religious studies, and education, as well as law. She's been an active advocate for the rights of women and children, and has been at the forefront of promoting and protecting their rights. And we're very happy to have them, and I'm very excited to hear from you. Thank you.
Thank you, Singu. Good afternoon. Just right now, we have been very well helped about this evidence family scale program from Indonesia and Philippines. Our college, they have been highlighting very much about the effectiveness and efficiency. Not the light Myanmar contents, the two programs mostly we have been heard about is more on the stable settings and settings. So what we would like to share right now is this evidence-based program is not just on the stable settings. It's also very effective in the settings light Myanmar. So we would like to share those evidence in our presentations. I will share this small case study part, and my colleague, again, she will share, how implementations challenges in some resource limited and conflict affected settings. Yeah. So as background information, our study we have been done in our northern part of the country, Myanmar. So in that area, you may have been heard that we have a decade of a conflict between our military troop and the ethnic armed group there. So a lot of families, they were displaced because of the fighting. So you can imagine that those family, the kids who was born in those affected area, they have been suffer a lot of mental problem. So, we see a lot of post-traumatic stress disorder, PTSD. So in here is the kid who was growing with those mental problems. The drug is already available in those areas, so they can easily, use the drug like YABA, and in our case we have a heroin as well. So that's the contents of our study area. So why family interventions? That's our colleagues, Luki and Shella, they have been well set up. And also we have been very well noted this morning, our keynote speaker, the minister minister from the Ministry of Justice, he also was said the family is very important when we looking on the drug preventions, So the family level, we really need to look both to prevention and treatment as well. And also, like Zingo already mentioned, that the study, the intervention is already, endorsed in our international standard on drug use preventions. But in here, I just want to share with all of you that whenever we talk about the prevention with some high-level policy makers, we usually thought that the prevention, it's like usually because the young people, their lack of drug knowledge, that's we usually talk about. But on reality, in this program, you will see we never discuss about this drug issue, rather than we focus on the protective factor of the family level. So that's a significant, experience I want to share here. So that we need to look more evidence-based when we are looking, referencing on the prevention model. So the study is quite similar, like my colleague from Philippines and Indonesia, except we are not looking on the case control group. We only looking at 100 family who live in the IDP camp. So the results and all the two, we are quite similar. We use and here what we have seen so far is as Shella already mentioned, before we give the training interventions, we measure one times survey. So baseline indicators, that is we see pretty high, around 20 STQ. STQ score is in here. I just want to share that it is like kind of looking on the mental health, conditions of the young people, what we are giving intervention. So if STQ score too high, if they grow up like this, around 20 score, definitely those kids where we go to the, very high risk behavior, definitely they will use the drug like YABA and heroin. So that is the point we are here. We don't want to grow up in those kids with those such a big mental health, disorders and school. So after the intervention, we see almost they going to the average normal level mental health score. So that is a very significant. We have seen, especially the IDP settings, internet displaced person settings. That's we see very effective. So for the implementation part, like Shella and Luki already mentions, that's strong family planning. We don't need a lot of high resource, even very low resource, and even difficult setting like us, we can make implementation. So for the better, experience and lesson learned to share, may I invite my colleague, Ms. Kanye. Yeah.
Good afternoon, everyone. I would like to present by Myanmar language, please.
Yeah, okay.
ဆရာဒီကျမတို့ဒီမြန်မာနိုင်ငံမှာကချင်ပြီးတော့ကျမတို့ရှမ်းပေါ့နော်ရှမ်းပြည်နယ်တောင်ပိုင်းမှာ strong family program ကိုကျမတို့စပြီးတော့လုပ်ကိုင်ခဲ့တာ2024ကတည်းကစပြီးတော့လုပ်ခဲ့ပါတယ်အဲ့လိုလုပ်တဲ့အခါမှာမိသားစု193စုနဲ့စပြီးတော့ကျမတို့အကောင့်ထဲပေါ်ခဲ့တယ်ပေါ့နော်
The study started from Kachin, northern part, in 2022, but now we're scaling up, especially Ms. Kenny and their organization, they are implementing the southern Shan state, which is the border with the Thailand as well, yeah.
ဒီရှမ်းပြည်နယ်တောင်ပိုင်းမှာကြတော့ကျမတို့ဘယ်မိသားစုတွေကိုအဓိကတက်ခတ်ထားလဲဆိုရင်ကရားကပြောင်းရွှေ့လာတဲ့မိသားစုတွေကိုလည်းကျမတို့ strong family program လုပ်တဲ့နေ့တူရှမ်းပြည်နယ်တောင်ပိုင်းမှာရှိတဲ့ဒီရှိနေသော community မှာရှိတဲ့မိသားစုတွေကိုလည်းကျမတို့ဒီ strong family program ကိုစပြီးတော့အကောင့်ထဲပေါ်ခဲ့ပါတယ်
They are focusing more on the IDP community and the host community who was displaced another province just near southern Shan state. We call it the Kayan state. Yeah.
အကောင့်ထဲပေါ်တဲ့အခါမှာ strong family ကဘယ်လောက်ထိအရေးကြီးလဲအရေးပါတယ်လဲဆိုတဲ့အရာကဒီမိသားစုနဲ့အတူလက်တွဲပြီးလှုပ်ဆောင်တဲ့အခါမှာပို့ပြီးတော့တေချာတိလာတယ်တကယ်လိုအပ်တဲ့အစီအစဉ်တစ်ခုဖြစ်တယ်ဆိုတဲ့ဟာကိုကျွန်တော်တို့ကောင်းကောင်းနားလည်ခဲ့တယ်
Before and after the implementations, the way of community and CSO understanding is very different. Before, they are not too, family as much as a very important protective factors. Later on, they see family is a very important protective factors to prevent the drug use.
လောက်ဆောင်တဲ့အခါမှာကျွန်တော်တို့ဒီ session တွေ3ခုပေါ့နော်ပထမပတ်ဒုတိယပတ်တတိယပတ်ဆိုပြီးတော့ကျွန်တော်တို့ဒီ strong family ကိုဒီ3ရက်သက်ပတ်3ပတ်ပေါ့နော်ခွဲပြီးတော့လှုပ်ဆောင်ခဲ့ပါတယ်
Yeah, that's like similar approach we use like other country, quite similar to we use like 3 sessions in 3 weeks.
အဲ့လိုလှုပ်ဆောင်တဲ့အခါမှာဘာတွေအကျိုးကျေးဇူးရလဲဆိုကျွန်တော်တို့မြန်မာရဲ့ context အရာတခုဆိုမိဘတကပဲစကားပြောမယ်နားထောင်ဆိုတဲ့အရာလေးတွေရှိတယ်ဒါပေမဲ့ဒီအစီအစဉ်လေးကိုလှုပ်လိုက်တဲ့အခါမှာသားသမီးနဲ့မိဘကြားကတကယ်ကိုဆက်သွယ်ဆက်ဆံရေးကအရန်အားကောင်းလာတယ်ပေါ့နော်
So one of the significant benefit what they have seen is as our culture is like maybe a little bit Asian cultures, usually parents not appreciate, children to their children, So in the tools and the training modules that teach, we need to appreciate when the kids they are doing something good practice. So that's significant behavior change in their community. Yeah.
အဲ့လိုမျိုးနဲ့သွားတဲ့အခါမှာကျွန်တော်တို့ဒီ2024ခုနှစ်2025နှစ်စမှာကျွန်တော်တို့ဒီ program လေးတစ်ခုပြီးတယ်ပေါ့နော်ပြီးတဲ့အခါမှာဘာဖြစ်လာလဲဆိုတော့မိသားစုတွင်ကြားထဲမှာအရန်စီးနှောက်အားအရန်ကောင်းသွားတယ်သားသမီးနဲ့မိဘကြားကနားလည်သွားတဲ့အရာလေးကမိဘကဘယ်လောက်ထိစိုးရင်ပူပန်တယ်လဲသားသမီးကတိတ်ပြီးတော့ဒီလောက်ကတော့မိဘကတော့မဖြစ်တော့ပါဘူးဆိုတဲ့အရာလေးမဟုတ်ဘဲနဲ့သူတို့သားသမီးနဲ့မိဘကြားမှာရေချိန်လေးတစ်ခုကြိုက်သွားတယ်ပေါ့နော်မိဘနဲ့သားသမီးကြားတစ်ခုခုဆိုရင်ညှိနှိုင်းပြီးတော့ရှေ့ကိုဘယ်လိုဆက်သွားမလဲမိသားစုတစ်ခုရဲ့ goal တစ်ခုကအကောင်းတစ်ခုကအကောင်းတစ်ခုကအဆိုးမဟုတ်ပဲနဲ့နှစ်ခုလုံးစုံအတူတူကောင်းခြင်းကိုဥတည်ပြီးတော့သွားတာလေးတွေကိုကျမတို့သွားတွေ့ရပါတယ်
Although they just started in 2024, just recently, 1-year program, but as a very immediate outcome, they have seen that in the family, parents and children, their bondings, their, way of communication, those all improve a lot.
နောက်ပိုင်းမှာကျွန်တော်တို့ပြန်ပြီးတော့ follow up လိုက်တဲ့အခါမှာမိသားစုတွေကြားထဲမှာပြောင်းလဲတဲ့ဖြစ်စဉ်တွေအများကြီးသွားတွေ့ရတယ်။သားသမီးကမိဘကိုအကောင်းဆုံးအချိန်ပေးလာတယ်။မိဘကိုသားသမီးကပြန်ပြီးတော့နားလည်လာတယ်။ဒီကြားထဲမှာမိဘနဲ့သားသမီးကြားဟန်ချက်ညီညီလှုပ်ရှားနိုင်တာကိုသွားတွေ့ရပါတယ်။
So not just bonding as a practical way in their daily life of communication, that's also improved a lot. Yeah.
ဆိုတော့ကျွန်တော်တို့ရည်ရွယ်ထားတဲ့အတိုင်းပေါ့နော်တခုဆိုမိသားစုကြားထဲမှာတယောက်နဲ့တယောက်နားလဲတဲ့အဓိကကြတဲ့ဘယ်နေရာပဲဖြစ်မိသားစုကအဓိကကြတယ်အဓိကကြတဲ့နေရာမှာနားလဲမှုအပြည့်နဲ့တဦးနဲ့တဦးပြန်လည်ပေးဆက်တဲ့အခါမှာဒီမူရစေဝါဆိုတဲ့အနည်းကိုလည်းကျွန်တော်တို့တားဆီးကာကွယ်ပြီးသားဖြစ်သွားတယ်အဲ့လိုတားဆီးကာကွယ်တဲ့အရာကကျွန်တော်တို့ဒီအသက်ရှင်တဲ့ဘဝတစ်လျှောက်လုံးကအရန်အရေးပါတဲ့အရာဖြစ်တဲ့အတွက်ကြောင့်မို့ဒီ program ကအရေးကြီးတဲ့ program တစ်ခုဖြစ်ပါတယ်
As a conclusions, even they are not teachings about the drugs message in the training. At the end, that's really improving family bondings, and it can improve the preventions of the substance use at the end. Thank you.
Thank you.
Thank you. So. Yeah, to conclude our presentations, our study, we can see in this link as a full publications. And by the way, we also have a booth show together at the booth show corners, for better, to save the times and further discussion, we can also discuss in there. Thank you so much.
Thank you very much, Brang and Ms. Kenny, for sharing the experience and also highlighting the positive impacts that you're already seeing on the ground. That's really interesting and happy to learn that. So, lastly, but not the least, we have Dr. Wichuda Jirapon Sharon. She is a faculty member in the Family Medicine at the Faculty of Medicine, Chiang Mai University. She specializes in curriculum development in addiction medicine with extensive experience in patient and family care as well as community health promotion. She is also an active researcher in program evaluation and qualitative research. Currently, she is part of the evaluation team for Thailand's pilot Strong Families program, and we're very happy to have you here, and thank you so much for joining us. And the floor is yours.
Thank you. Good afternoon, everyone. Today, I'm happy to share our result from Strong Family that we do pilot work in the north part of Thailand. And thank you for letting me the last person because I think I have another view to share. We just a small project and we can share you another view of using Strong Family. Our team realized that Strong Family has a lot of evidence to support its really useful effectiveness. So we start with the community themselves who interested to learn about this and use it. Maybe different from another place that try to start with the agency or big government. But let's see about the NGO work and community themselves when they work. The Strong Family still work or not. Okay. So Thailand is the same. We face the problem like other places. The rapid changing of everything. So we have problem of family, like the dysfunction of family, the behavior that's be problem like substance use, game addict, and even domestic violence. So why Strong Family is very important for many pairs right now. In our work, I and my colleague, which she around here, also be a part of the project that Dr. Apinan, he is PI from our country. The project ran during June to July 2024. We have 8 locations in north part of Thailand. The program still stay the same with everyone 3 weeks and start with TOT trainer of the training program first, and then the trainer will become a teacher and teach their own people in their setting. Continue 3 weeks, like first week with caregiver, and second and third week will be caregiver and children parallel session, and then they join together. And this is a big team who run Strong Family. Most of them are the member from UNODC and the cute picture. Many people may familiar face around here, and I and Dr. Nida, we have a good chance that we worked with Dr. Apinan before. He is former head department of our department, Family Medicine, Chiang Mai University. And then they asked our team to join and evaluate the project. So, and you can skip this part. I know everyone know about what they learned. And we have volunteer for the trainer from this pilot project. We have 30 people join the project, and most of them are very active and Thai people. Then they teach the people in their community. There is around 70 family join from a side, but we can collect data around 40 family. You may know it's quite difficult when we try to collect the data from the first, second, and third week. So only around 40 family that we can collect all the data. So this is our protocol of works, which I think quite similar to other places. We use qualitative and quantitative data to confirm this evidence. And for qualitative data, we use LEAM framework, is evaluation framework that we use. And for the quantitative data, UNODC suggests us to use parent and family adjustment, emotional and behavioral outcome, and the last thing is child resilience skill. So we come up with the result of LEAM framework. In here, list we try to find who we list to who we deliberate the program and the effective of the program, who adopt this, and how it fit well when we implement it, the program in the community, and how the community try to maintain it. Let me explain in each component from LEAM framework. By list, most of the family who join are a family with children aged around 8 to 15, which is the same like other place. Most of them are people who run routine community activity. We work with the tribal group who participate in religious mechanism like church, temple, and this is the place that have very good relationship with the people in their own community. Another thing that we learned is for the area that are limit in literacy, the announcement or the by using the poster is not work. You have to use verbal communication and confirm people that have to join the project. And the key person who help us to do this is the leader community. So if leader community, they think this very important, they will find the participant, and the participant around will join the project. Even hard to reach group, we think the substance use family psychological issue like family with depression may be difficult to join the project, because when they join with other some session they talk about how good of the family like this, so it's very difficult. But we found that some setting they can find people who hard to reach group and work with them very well, because they have a drug rehabilitation center there. And also the protective care and welfare center, the NGO who run this kind of organization can use the caregiver as a parent instead of real parent, and children who join the project in their organization. So you can see that by community themselves, even NGO until organization like Ministry of Health can work with us very well. So the quantitative that I will share is about the parental adjustment, family cohesion, and behavioral problem among children. That is quite in positive way, and that's make the relationship in the family, communication, and stress management well. I would like to pass this quite fast, because it's similar to other that we have the positive effect to the strong family. ไหมคะอันหน้าอีกหน่อยค่ะอีกหน้าอีกหน่อยค่ะอ๋อหมายถึงว่าขอโทษนะคะอ๋อเปล่าค่ะอันนี้ไปข้างหน้าใช่ไหมคะอ๋อโอเคค่ะ So this, for example, the child and youth resilience, you can see that the score increased from nearly 10 score in 6 weeks. For the qualitative data, we found that we interviewed 10 people who are trainers in the setting, and they share the experience of using the strong family and the feeling or the conversation that they have with a family themselves. They talk about the program that really highlight for the participant is focusing on stress management that make family happy. Many people may not know that it's just such as easy activity that people think it can reduce their stress very well, and parents learn positive communication and saw change in their children. For implementation, the NGO working with Tribe True Religions Organization, Political Care Center, and the Ministry of Social Development and Human Security, just one setting that joined us. And the end of the program, we found out that the Ministry of Social and Development in the province, I mean, every page in the province will continue using Strong Family and also have funding and working with the community to help the community run Strong Family in the next phase. ไปเร็วไปหน่อยค่ะ For the validity and challenge, you can see some participants, they changed and they add the conversation by their own language. That means they, like another country, many countries, that they have their own language. So that will be easily to adopt in their own setting. But the challenge is about time management. And like you said, that they want to share and students still fun with the game and they can't control this. But it's fine because they think they should respect the time for the participant as well. For the language translation, sometimes it's quite difficult for them because it's like we translate from English to Thai, so some setting translate to from Thai to their own language, so it's not easy. And another thing about material, most of them say it's very easy to use. It's just a book and a workbook. It's like quite straightforward, easy to use, clear, and with the detailed step and suggested dialogue. And very important is the hand-on approach that practical to all groups, including illiterate family. For the cost and effectiveness, it's very low cost. The money they use is just only the food and the drink for the family who join the project. They use this opportunity like in the evening, so if they can find food and drink for people, so they don't need to hurry to find this for their own family. And some money come from the transportation and accommodation for trainers who work with the remote community. For culture adaptation, we found that some community or ethnic, they cannot hug. It's quite maybe not easy from Asian people like foreigner like European too. Yeah. So they change hug to be shoulder pad instead. Even in the protective care is the rule that caregiver cannot hug the children there, so they use this. and visual tool were it's like a cartoon that's not real. Some trainer feel like they can express this feeling, so they just change to be real human expression instead of using the cartoon in the book. About sustainability, nearly end for the maintenance phase. We found that focusing on the developing volunteer local trainer will make more strong families still continue in the community. And the community development center and existing funding, I think still need for them just seed money, which when we provide this information back to the community, they say it's simple because the community themselves has money for the people in the community. Another thing is about building strong relationship between trainer and family was identified as a key motivator for continued participation. Even they finish to join 3 weeks, they come again and ask, do you have another program again, like it make their family stronger. For trainer support and skill development, we found that trainer in the community, they still need feedback from instructor. They would like to feel confidence when they talk and they run the activity. Another skill that is very important that they comment is about when they're dealing with the uncertainty and difficulty situation, which we didn't teach them, and we think another phase we add this part, like when some people in the community, the family have agreement, someone angry or silence or crying, they don't know how to dealing with this situation. Another thing that I hear from the speaker today, I think online session, like monitor online session may still important, or even the e-learning, like make the trainer themselves can review some activity that they train in TOT and forget, or some activity forget it. Okay, for the long-term impact measure, which I realized that many countries do a lot of family and should continue like monitor more than a short time, may be important for we to continue another phase as well. In conclusion, by using the M framework, I think we can evaluate the whole picture of the program that strong family, improve family dynamic and child resilience, and it's still we identify specific area for refinement like material design, which not much does make people in the community understand easier, or cultural adaptation and long-term trainer support for border, and can help sustainable expansion. Thank you. Thank you for your attention.
Thank you very much, Dr. Wichuda, for also sharing the practical aspect of the program implementation and the qualitative evaluation of the program. This is really very informative and very interesting. So do we still have time for question and answers? 5 minutes. So we have 5 minutes for questions and answers. So I'd like to open the floor for any questions and answers that colleagues might want to have. So if we do not have any questions and answers, then I like to maybe give a question to each of you, each of the teams, to reflect on. What will be your recommendation, like one point for those who want to, any of those who want to implement the program in their own setting? What would you recommend, like 1 point each, maybe?
1 point for maybe if you want to implement this program. This is an easy program because you can conduct it just by reading the manual. So do please implement it. Try to implement it, this family skill, either it's Family United or Strong Family, because it's easy and it's cheap.
So please do
and
consider.
practical. Please do consider.
No, I think, Zinko, there's one thing that I forgot to highlight in our analysis, because there's a part there in terms of sustainability. There's a part there when it shows there's improvement from the first time we collect data to the second point that we collect data. But on the third point, there's no more improvement. So it proves the point that it's important to have booster session to increase the sustainability of impact of the family skills-based program. Because remember, prevention, there's no one-size-fits-all, and there's no standalone program. So a combination of with other programs would actually increase the impact, the positive impact of the family skills-based program. Yeah.
Thank you.
Strong family is the main frame of the community. So we have to empower them, we have to educate them, we have to train them in order for the community to thrive and to make our better world. Thank you.
To conclude and end by my end, I want to quote two motto. You all have been heard that, prevention is better than cure, right? So on the other hand, prevention is cheaper than, some who extends. And on the other quote, motto for this 2025 YABA&Drugs, the motto is evidence is clear, let's invest in prevention. So I want to encourage, let's invest in preventions too all. Thank you.
For me, I think the simple and the easy is the best, which I think strong family is represent this.
Sure. Thank you so much for all these comments. Like our panel members have highlighted, prevention is not talking about drugs. It's raising awareness alone is not sufficient to prevent people from starting to use drugs. So what we need to do is to invest in effective evidence-based prevention interventions, and this is one of the programs that has been proven to be effective scientifically. So like they said, please consider these programs if you if you want to implement some prevention programs in your own settings. So with that, I would like to say thank you very much to our speakers again, all of them. And they have prepared posters and documents that are displayed at the booth, prevention booth, near the end of the hallway. So please visit their booth, and you can also interact with them. They will be around. And you can also scan the QR code here for the information on the UNODC family-based prevention programs. And thank you very much to our speakers again, and thank you very much to you all, and we'll see you around. Thank you.